I'm sorry, we are meeting after 2 weeks today, but I am going to give you a delightful story. The story of anesthesia. Right till about the middle of the 19th century, surgery used to be performed on individuals without dulling their sensorium to any significant extent. Surgery had to be finished in less than 5 minutes because the pain of surgery was unbearable. And patients could die of shock because of the severity of pain, or they could die because of the blood loss, or they could die subsequently because of infection in that particular area. The best anesthetist, actually, anesthetist agent at that time, before actual anesthesia was discovered, was a dose of opium and a large dose of alcohol so as to put the patient to sleep. But even then, at the first touch of the scalpel, the patient often would scream in pain and would have to be held down, both arms and lower limbs being pinned down by people. Story of anesthesia is remarkable because once anesthesia was really discovered, the surgeon could perform at leisure, slowly, carefully. What is more, the patient was relaxed, the muscles were relaxed, so that surgery was easier. Once again, the first inroad in this story was not by a doctor, but by a chemist. It was Priestley who discovered nitrous oxide. And it was Humphrey Davis, the man, of the Davis lamp, the lamp used by miners when they went down, the safety lamp. It was Humphrey Davis who realized that when he inhaled nitrous oxide with his friends at any time, they would get into a frenzy of laughing, a laughing fit. And if they continued to inhale, they would become unconscious. And he made this astute observation that even before the loss of consciousness, they were oblivious to pain. So that if they hurt themselves, they would not feel any pain. They brought this to the attention of the medical profession, who funnily enough ignored it. Next comes Michael Faraday. Michael Faraday observed that when he inhaled ether, or when ether was inhaled by anyone, again it led to a slightly happy effect on the disposition of the individual, and then induced sleep. Here again, no pain was experienced when pain should have been experienced. He again brought this to the attention of the medical profession. Why not use it at surgery? Again, there was no response. Now, both nitrous oxide and ether went into oblivion and was brought out from oblivion, funnily enough, not by the medical profession, but by show business. Can you believe it? Scientific shows used to be held in America at street corners sometimes, showing off certain scientific or semi-scientific methods. One of them was to use nitrous oxide on patients or on individuals who would volunteer to have them used on them, and they would laugh and they would be merry and they would often go to sleep. And that was a show, and that would gather in some revenue. Now, a man called Samuel Colt. Remember, Samuel Colt was the man who first designed the Colt revolver. He wanted to raise money for this revolver, and he decided to get into these road shows. And he went from one road show to another with considerable success. Ultimately, he decided that he wanted more money, so he rented a hall so that many people could see the show. And the hall was completely packed. And he decided to use nitrous oxide on 6 Red Indians. So the Red Indians came on the stage, our friend Samuel Colt delivered or made them breathe the nitrous oxide and was waiting to see them laugh and make merry. But unfortunately, all the Red Indians, 7 of them, just went to sleep. Colt was frightened. There were these lumberjacks and these blacksmiths all in that audience, and they hadn't paid him money to see the Red Indians take a nap. So he called one of these lumberjacks up and said, "Now come on, man, you inhale this." And the lumberjack inhaled nitrous oxide and he burst into laughter and became extremely excited. He chased Colt all over the stage and ultimately he collapsed on a heel. He collapsed in a heap on the Red Indians asleep on the floor, at which the Red Indians awoke. This provoked great laughter and Colt had saved the day. But he realized that these shows were not for him. Now we come to a stage in American social life when ether and nitrogen oxide was used to make people gay. Gay meaning happy, at parties, just as people today use amphetamine, dexedrine, and all sorts of various combination of drugs to make themselves high. So they used to use ether or nitrous oxide, inhale them to make themselves happy and make themselves make themselves very, very happy and boisterous during the time when they had their parties. And one fine day, there was this doctor whose name was Dr. Crawford Long. A handsome young doctor, very fond of girls, and the girls were very fond of him, and he used to go to many of these parties, and he noticed once that when he would inhale ether and had fallen down and bruised himself badly, it did not pain him at all. And he said, "My goodness me, could I not use this as an anesthetist for surgery?" So he had a patient called Mr. Venables who had 2 tumors on his neck, but who refused to get operated unless the doctor could assure him that there would be very little pain. So Crawford Long tells him, "Now here I have something which will have no pain at all. Will you agree?" So he agreed. And for the first time, ether was used to anesthetize this patient. He inhaled ether, the patient went to sleep. Dr. Long removed the 2 tumors on his neck, and he makes a note in his diary. Mr. Venables, patient, 2 tumors removed, fee $2. And he writes the date. But unfortunately, he forgets about it. He doesn't inform the medical fraternity. He doesn't write this up at all. He does a few more operations with ether as the anesthetist, but he doesn't make any note of it at all. He doesn't report it at all, and he wakes up only when this has been discovered and written about by somebody else, as we shall see soon. Now we come to another man. His name was Horace Wells. He was a dentist, and he attended one of these big shows where one of these showmen called upon a volunteer and made him inhale nitrous oxide. And this man happened to be sitting next to Horace Wells. And this man goes on the stage, inhales nitrous oxide, and again he laughs madly, runs around the place, hurts himself, and finally comes and plonks himself down near the dentist, Mr. Wells, Dr. Wells. Dr. Wells remarks that, "I think I could use this for removing teeth." So he calls the man who has started or who was responsible for the show and requests him to give him nitrous oxide and come with him to his dentistry so that a colleague of his could administer nitrous oxide to him and could remove one of his teeth to see whether it hurt him or not. This happened. They go to his dentistry, his consulting room. Dr. Wells lies down. He is given the nitrous oxide by a gentleman, and one of his colleagues pulls out his tooth. And this is what he said, "Oh my God," when he comes to this is the greatest discovery ever. I didn't even feel a pinprick. Now, Dr. Wells was a rather ambitious person. He thought he would make a lot of money out of this. So without trying it on many people at all, he decides to go to the Mass General Hospital and ask the surgeon, I can remove a tooth without anyone having the slightest pain. Please give me a slot. So the surgeon decided to give him a slot. A student volunteer comes, gives him the nitrous oxide. The student is half asleep. Wells pulls out his tooth, and as he pulls out his tooth, the student screams with pain. The whole thing was in a shambles. Poor Dr. Horace Wells retreats very quickly. He retires, as a matter of fact. He's extremely depressed, and we forget about him. But he had an assistant. He had a very astute assistant, and his name was William Thomas Green Morton. Remarkable name. Not only does he give his father's name, but also his grandfather's name. And a difficult name for anyone to remember. William Thomas Green Morton. He decides to join Harvard to become a proper dentist, qualify as a dentist. And during this time, he comes across a chemist also at Harvard called Dr. Jackson. And Jackson tells him, try ether, my dear chap. Try ether and you will find that it might work and might prevent patients from getting pain. So Morton goes ahead in full steam. He first goes home and tries it on his own home people. He takes his wife, his dog, a spaniel, and the wife who loved goldfish takes her goldfish bowl with her outside for a holiday. And there Dr. Morton first anesthetizes the poor dog, who goes to sleep to the mortification of his wife. And when she was just about to scream at him, the dog wakes up, runs around as if drunk, and that was it. Next day, he anesthetizes the goldfish, and the wife comes and sees the goldfish scattered on the carpets. And she loved the goldfish. She used to see them morning and night. When she got up in the morning, when she went to sleep at night. And now they seem to be dead. But no, they were not dead. They were knocked out. Dr. Morton puts them back into the water, and the goldfish survive. And then Dr. Morton anesthetizes every creepy, crawly creature he could find, from earthworms to cockroaches to what have you. And then he also decides to try it on patients and finds that it did work. And then comes a young musician called Eben Frost. And he had his tooth removed, and there was no pain. And Eben Frost not only becomes his great pal, but his great exhibit, telling people how great Dr. Morton was in this respect. Now Dr. Morton approaches the professor of surgery at the Mass General Hospital and says, sir, please give me a slot. I can ask you to remove do any surgical procedure you want, and the patient will have no pain. The surgeon, whose name was Dr. Warren, Surgeon Warren, gives him a slot. And Morton then decides to have a machine made, a simple machine made, to enable him to give the anesthesia, which was ether, in a proper fashion. The chap who was to make the machine promises that it will be done well before the date at which this procedure was to take place. The day arrives. I think it was an important date in medicine. It was the 16th of October, 1846. The whole amphitheater is crowded by doctors and students. Something great is going to happen. The surgeon informs him that this is what is going to happen. At 5 minutes to the right time, the patient is wheeled in, a thin white man with 2 tumors on his neck. The crowd waits with bated breath. 5 minutes up, Dr. Morton hadn't arrived. 10 minutes, 15 minutes, the crowd starts to snigger, thinking that this is another big hoax. They had seen such hoaxes before. And then the surgeon lifts up his scalpel and says, gentlemen, it seems that Dr. Morton is otherwise occupied, so we shall begin. And he's about to make his incision when Morton bursts in through the door. Apologizes, sorry sir, but my instrument maker Took a longer time than I thought that it would, but I'm ready. I'm ready. Very sarcastically, the surgeon looks at him and said, your patient is ready. Whereupon Morton gets to work. He has a glass tube which he inserts into the mouth. He has Ibn Frost, his protege, near him. The protege explains to the patient, don't you worry, I've had this done to me, I've had no pain, just relax. He inhales the ether. He goes to sleep. And then Dr. Morton tells the surgeon, sir, it's your patient now, your patient is ready. Whereupon the surgeon operates, removes the two tumors, and after a time, the patient wakes up and he has had no pain. There was stunned silence in the amphitheater. This was indeed a great, great discovery. And the surgeon says, this is no humbug, gentlemen. This is something great. So that's how it was William Thomas Green Morton who discovered the use of anesthesia. The story doesn't end there. There were others who wanted to claim the throne, claim the credit for discovering this. There was Crawford Long, who suddenly woke up and said, but I was removing with ether these tumors before you all did. But he hadn't reported anything. He hadn't mentioned it anything. So they say he didn't count. And there was this chemist Jackson who said, I told Morton to use this sort of ether. And that is why the anesthesia came about. So unfortunately, there was a big tussle. And many people thought it was one who was responsible. Others thought it was another who was responsible. And poor Morton was mortified. He sold off his practice. He just went about propagating the use of ether as an anesthetic. He was almost bankrupt. He managed just to save his house. He died at the young age of 49. At the end of the story, the credit now is given to Morton, William Thomas Green Morton as the discoverer of anesthesia. Now in Scotland, there was a Scottish doctor who was using ether, and he found that ether was very irritant to the tissues, caused cough, caused bronchitis. So he decided to use chloroform. And he thought chloroform particularly was very useful when used on women delivering babies. And he went on doing that. And when the clergy heard of this, they were furious. They said, you're doing something which is unnatural. A woman is supposed to have pain when she brings forth a baby into the world. You're doing something which is immoral. Isn't it written in the book of Genesis that thou shalt bear forth a baby with pangs of pain? How can you do that? It's against the religion. Surprisingly enough, there was a lot of support to this theory that you should bear pain in pregnancy. It was the right thing to do from a number of people. Whereupon, poor old Simpson, fed up, replied, tell me, when God made Adam, how did he make Eve? Didn't he make Eve from the rib of Adam? Well, if he did so, he must have anesthetized Adam. So that was one thing. Then in America, people in Philadelphia also said, you can't do that. It is but natural. You let them have pain. That's the right thing to do. That's the natural thing to do. To which my friend Simpson says, well, my friends, you surgeons from Philadelphia, when you next decide to come to New York, please walk and don't take the train. Rather nice and humorous, I thought. Very nice repartee by our friend Dr. Simpson of Edinburgh. But still it did not catch on. People were not keen on giving chloroform until Simpson became the obstetrician to Queen Victoria. And when she delivered her seventh child, I don't know how many children she had, I think it was 9 or 10 or 8 or 9, not quite sure. When she delivered the seventh child, and she took chloroform as the anesthetic, this anesthetic took off and people started using chloroform. This indeed, ladies and gentlemen, is the story of anesthesia.